Well, hello everyone. We are here on location today at the Vein Company, their Kingsport location, and we are joined by Dr. Randall Towne to talk a little bit about vein disease and the people that they continue to help here in our area and beyond. Dr. Towne, thank you for hosting us today.
Well, thank you. Privilege.
Well, you have been in this business helping people for so many years and continuing to see such growth, opening even new locations here in the Tri-Cities.
Yeah, we've actually expanded our operations. There are 2 offices in our Tri-Cities to include Johnson City, Kingsport. We've added an office to Abington, Virginia, in addition to our offices in Knoxville and Sevierville, soon to expand into the Chattanooga area.
Wow, which just goes to show so many people being helped by the services that you provide. Talk to me a little bit about your typical patient and the symptoms that they have maybe when they come in.
Well, typically to understand vein disease, you have to think of veins as a tube with one-directional valves. These tubes drain blood from the lower extremity of the entire body, deoxygenated blood, which is blood utilized by the body, transferred to the right side of the heart. The heart transfers it to the lung back to the heart, then it's pumped throughout the arterial system. So it's one complete circuit. So any disruption of the venous portion of this has considerably untoward consequences. Most of our patients range between 14 years of age up until the late 90s. Our nano and octogenarians, our older patients, tend to really perform well. And this is a disorder associated with damage to either the valve or the tube system. And it's due to either chronic inflammatory disorders. We see it postoperatively following knee hip replacement surgeries. Obesity plays an important role. Pre-existing lung disease, heart disease, liver disease, inflammatory disorders. There's a host of underlying causes, but the final common denominator with the disorder and the way patients present is a sense of chronic discomfort, pain, heaviness, a sense of burning, itching is of concern, in addition to some neuropathic disorders, kind of neuropathies or restless leg. And when we see them in the office, we initially interview them, coordinate an ultrasound, and then we define the appropriate treatment modality, which differs from individual patients.
And I have been able to meet some of your patients and to hear their stories, and some of them come to you really not able to walk completely on their own. It has gotten that bad. And to see the progress that you've been able to make, it's pretty incredible.
It really is. A number of folks come in with a different spectrum of disease. Some of it may be mild with these scattered veins. Others are very complicated with marked swelling, an inability to walk. And we've found a significant improvement in our senior population, limiting their ability initially when they present themselves, and post-treatment they're up, they're ambulatory, they're moving, and it's incredibly gratifying to see that.
And I know, Dr. Towne, you have several different products that you're able to use sort of in your tool belt when it comes to treating these. I know everything's kind of on a case-by-case basis, but a lot of exciting news coming through too when it comes to treatment.
Yeah, there are a host of new modalities available. A newer agent is known as VenaSeal. It's actually an endovascular or an intravascular glue. It's similar to what we do when we close wounds with that surgical glue. And it's one that requires no needle pricks. It's relatively painless. It's done as an outpatient, and incredible long-term outcome. The other modalities are typical catheter-based, where we use radiofrequency ablation. We have other modalities with less complicated disease to include intravascular sclerosant agents that are guided by ultrasound. And then we do microphlebectomies procedures as well.
When I think people are thinking about veins, a lot of people think about the appearance factor. They don't, they don't like that look of it, but the underlying problems and conditions can be so much more damaging too.
Oh, absolutely. There's a continuum. Some folks will start out and their initial symptoms may be swelling and maybe just scattered varices or branches. This reflects an underlying issue. And so we don't approach cosmetic aspect of it. We address the underlying issues that often present with only mild changes in the skin.
Yeah, left untreated, it can go and be very bad.
Oh, the consequences are concerning. Any venous ulcer, we're looking at months to years worth of time required to treat these. So our goal is to interrupt those changes, limit a lot of the skin and dermatological changes, and really improve outcome.
Yeah, and I've seen you do wonderful things here, and want to let people know too, obviously with the pandemic, you were telling me most of those healthcare providers here, you're already vaccinated, and of course sanitizer everywhere, so definitely practicing some safe procedures.
By all means, the entire medical team has been vaccinated. We exercise the utmost caution in reference to our patient population.
And also have telemedicine, I understand too.
Telemedicine is an opportunity to communicate for some of those patients, in particular with their histories and their follow-up procedures or follow-up discussions. And it's a modality that's really quite beneficial.
Yeah, you're doing incredible work here at the Vane Company. Dr. Towne, thanks so much for hosting us today.
Thank you. It's been my privilege.
We'll give everybody the information. Don't forget, several locations right here, conveniently located in the Tri-Cities. You can also check out the website, thevanecompany.com.
The preceding portion of Daytime Tri-Cities was sponsored by